Hi everyone, my name is Dr. Mazhar and today I would like to talk about basics of ECG. Actually, what is ECG? Before knowing about ECG, it's important to know about the clinical feature of the patient. Sometimes ECG not give us so much idea, so we just take a help from ECG. When you are working in an emergency or when you are working in a ward, so or in an outpatient department like in OPD, so patient come to you with complaint of chest pain or typically MI like radiating toward left arm or numbness in the fingers. So first in your mind comes ECG. If old patient, so when you did ECG, but in the ECG, if you will not find anything, but clinical features show that maybe patient have acute coronary syndrome, then you order trop 3 or trop I. So when it comes positive, so you label the patient that patient have non-ST elevation MI. So to knowing about the ECG is important, but the ECG plus patient clinical feature is very important because ECG give you an idea or helps you to diagnose the cardiac patient. When a patient come to you in the emergency department, young patient come to an emergency department, any complaint of chest heaviness or palpitation, so maybe in your mind come in the anxiety element or panic disorders like that. But if old patient come in emergency department with same complaint, maybe you think about ischemic heart disease because age is different, and in a male more cardiac issues as compared to female. So you when you order the ECG, so ECG give you idea. So in the ECG, what we will see? In the ECG, we are seeing first of all, in the ECG, we will see the rate. What's the rate of the patient? So what's the rate of heart? So normal heart rate is 70 to 100 beats per minute or 60 to 100 beats per minute. Secondly, we will see the rhythm. Either it's regular or not. Mean every R wave is every R between two R wave distance is same or not. Secondly, we will see the P wave. That P wave is followed by QRS complex or not. In my later video, I will teach you through ECG, but right now I just giving you idea. So if P wave is followed by QRS complex, every P wave is followed by QRS complex with a normal PR interval. So it means rhythm is normal. Then second, we see that if P wave is followed by QRS complex, so then QRS complex is broad or narrow. Normally it's a narrow, but if it's so much narrow, when it's so much narrow, so it can be a supraventricular tachycardia. But when it's a broad, so it's a ventricular tachycardia. So third, we will see the T wave, either T wave is present or not. So when someone, if you are working in an emergency or in a ward and someone brought a ECG to you, so first of all you see that what's the rate, either it's a normal or not. Secondly, you are seeing the rhythm in the ECG strip, either P wave is followed by QRS complex or not. P wave is normal morphology or not. Either P wave is when is followed by QRS complex, so PR interval is normal mean 2 to 3 box or not. Thirdly, you see the QRS complex, either QRS complex is normal or not. Thirdly you will see T wave. T wave is present or not. And then you will see the thing that how you can go to systematically. First of all, name of the patient, age, chief complaint, and any comorbidities. This is a systematic way. When you will go through like that, you will not miss anything. But if, for example, if ECG, someone brought ECG to you and you directly just see the rhythm and you didn't know the clinical features, so maybe you misdiagnose the patient. So someone ECG come normal sometime, but patient clinical feature shows some pathology is there. So when you order the test, in the test you will see, yeah, there is some pathology. So ECG just gives you idea, helps you to diagnose the cardiac patient, but the clinical features plus ECG give you accurate diagnosis that now my management will be changed. So keep in mind that when ECG brought to you, first of all you see the name, what's the name of patient, what's the age, are young or old. Thirdly, if old, any comorbidities like hypertension, any diabetes or not, any cholesterol high level or not. This you will see. Then the clinical features, then family history. So it will give you idea. because this is a systemic view. This will give you idea to diagnose a patient properly, and if it's a cardiac patient, then you manage accordingly. So hope you understand, and hope this video helps you. Thank you.